Welcome to your complete guide to Medicare. Everything you need to know. We're here to help seniors navigate the maze of Medicare so, you can feel confident about your healthcare choices. So what is Medicare? Medicare is a federal health insurance program that helps cover your medical costs when you turn 65 or qualify due to certain disabilities. Think of it as your safety net for healthcare in your golden years. Here's what Medicare is. It's a federal health insurance program for eligible Americans, funded by taxes you've paid throughout your working years, and it provides individual coverage, just for you, not your family. Now here's what Medicare is not. It's not free. You'll have some costs. It's not a family health plan, it's not the same as Social Security, and it's definitely not the same as Medicaid. Who can get Medicare? Well, you're eligible for Medicare if you're 65 or older, which is the most common, under 65 with a qualifying disability after receiving disability benefits for 24 months, or any age with end-stage kidney disease or ALS. You must also be a United States citizen or a legal resident who has lived in the U.S. for at least 5 consecutive years. So what does Medicare actually cover? Well, Medicare has different parts that work together. Part A, which is also called hospital insurance, covers things like hospital stays and inpatient care. That includes your hospital room and meals, surgery and recovery, skilled nursing facility care, hospice care, and even some home health care. And here's some good news. Part A is usually premium-free if you or your spouse worked and paid Medicare taxes for at least 10 years. Now, let's talk about Part B, or medical insurance. Part B is designed to cover doctor visits and outpatient care. That means things like doctor visits and your annual wellness exams, preventive services like flu shots, lab tests and x-rays, medical equipment such as wheelchairs and walkers, mental health services, and physical therapy. It's important to know that Part B does require a monthly premium, and that amount can vary depending on your income. But, it's also really important to understand what original Medicare doesn't cover. That includes prescription drugs, dental, vision, and hearing care, long-term care, and care outside the United States. Plus, there's no limit on your out-of-pocket costs. Since, original Medicare doesn't cover everything, you really have 2 main paths to get complete coverage. Option 1 is to add coverage to original Medicare. First, there's Medicare Part D, which helps pay for prescription medications. It's important to know that enrollment is required or you'll end up paying penalties and, different plans actually cover different medications. Then there's Medicare Supplement Insurance, also called Medigap. This helps pay the costs that original Medicare doesn't cover, gives you more predictable healthcare costs, and works anywhere Medicare is accepted. Option 2 is to choose Medicare Advantage, also known as Part C. It's kind of an all-in-one alternative to original Medicare. It includes everything in Parts A and B, usually adds prescription drug coverage, and often comes with extra benefits like dental, vision, and hearing. But it's important to remember that you'll need to use the plan's network of doctors and hospitals. Now, let's talk a bit about understanding Medicare costs. There are a few types of costs you'll pay. First, there's the premium, which is your monthly payment for coverage. Then, there's the deductible, which is the amount you pay before your coverage actually starts. You'll also have a copay, which is a fixed amount for each service, and coinsurance, which is the percentage you pay for services. When comparing Medicare Advantage and Medigap costs, Medicare Advantage often has lower monthly costs, but you pay as you use services. On the other hand, Medigap usually has higher monthly premiums, but your costs are more predictable when you need care. So, when can you actually enroll in Medicare? Well, your initial enrollment period is really important. You have a 7-month window centered around your 65th birthday. That means you can sign up starting 3 months before your birthday month, during your birthday month itself, and for 3 months after. And just a little pro tip here. It's a good idea to enroll early so you can avoid any gaps in coverage or those pesky late penalties. Now, if you're still working past 65, you might be able to delay enrolling in Medicare, as long as you have what's called creditable employer coverage. But I have to say, the rules can get a bit complicated and really depend on the size of your employer and the quality of your coverage. There's also the annual open enrollment period. Every year, from October 15th to December 7th, you have the chance to switch Medicare plans, add or drop coverage, or move between original Medicare and Medicare Advantage. Okay, let's talk about how you can save some money on Medicare. Here are a few smart tips. Use preventive services, since they're often free. Try to stay within your plan's provider network. Choose generic medications whenever you can. And make sure you know whether you're considered an inpatient or outpatient if you end up in the hospital. Now, for financial assistance, there are programs like Extra Help, which reduces prescription drug costs, and Medicare savings programs that can help pay your Medicare premiums. And if you qualify, Medicaid may cover some additional costs as well. Okay, let's talk about some common Medicare mistakes to avoid. First, missing your enrollment deadlines can actually cost you money and penalties, so it's really important to stay on top of those dates. Next, not comparing plans annually is a big one. Plans change every year, so you want to make sure you're still getting the best coverage for your needs. Also, try not to choose a plan based on premium alone. It's a good idea to consider total costs and coverage, not just the monthly price. Another mistake is not checking if your doctors accept your plan. This is especially important if you have Medicare Advantage. And finally, don't forget about prescription drug coverage. If you delay signing up, you'll end up paying penalties. Okay, so let's talk about your next steps. If you're new to Medicare, first, you'll want to determine your enrollment period. Then decide between original Medicare with supplements or a Medicare Advantage plan. After that, compare plans available in your area and make sure your doctors and medications are covered. And don't forget to enroll before your deadline. Now, if you already have Medicare, it's a good idea to review your current coverage every year. Check if your plan still meets your needs, compare costs and coverage during open enrollment, and make changes if needed. We're here to help, and just so you know, navigating Medicare doesn't have to be overwhelming. Our team specializes in helping seniors understand their options and find the right coverage for their needs and budget. You can contact us at 917-740-1895. We offer free Medicare plan comparisons, help understanding your options, enrollment assistance, and annual plan reviews. Remember, the right Medicare choice is personal to you. What works for your neighbor might not be the best fit for your health needs and budget. For additional resources, you can visit Medicare.gov, which is the official Medicare website. There's also 1-800-MEDICARE, which is a 24/7 Medicare helpline. The State Health Insurance Assistance Program, or SHIP, offers free local help, and the Social Security Administration can assist you with enrollment. Just so you're aware, this guide provides general information about Medicare. For specific questions about your situation, please consult with Craig Smith at 917-740-1895, email craigsmith@csmedicare.net, or contact Medicare directly. We are not affiliated with any government agency.